Now just to summarize what we discussed, we saw biotransformation, drug was getting converted from lipid soluble to water soluble, where it was getting converted in liver. This biotransformation was happening. After biotransformation, drug were getting converted from active to inactive, or active to active, or active to toxic, or inactive to active. Such drugs were known as prodrugs. We also discussed prodrugs. We had a mnemonic for this also. In biotransformation, what we saw, these biotransformation were carried out by two groups of reaction, phase 1 and phase 2 reaction. In phase 1 reaction, we saw oxidation, reduction, cyclization, decyclization, and hydrolysis. Among these, hydrolysis was from non-microsomal enzymes, and we saw oxidation in details. In oxidation, we saw various enzymes, that is cytochrome P450. In cytochrome P450, we saw its substrates, inducers, and inhibitors. Correct? In phase 2 reactions, we saw glucuronide conjugation, we saw sulfation, not sulfation, we saw acetylation, glutathione conjugation, and we also saw paracetamol toxicity and other like methylation, sulfation, and ribonucleotide synthesis were discussed. Okay. Later we saw first pass metabolism happening in liver. So this is the chapter we have discussed till now. Let's finish off with a few questions. See, following drug substrates and metabolizing enzymes are correctly matched. Substrate and enzyme. CYP3A4 metabolizes simvastatin. Correct or no? Yes, correct. Dia, Mirza, Queen, ancestor, Queen use lime, carrot, cycle as what? Substrate. Statins. Okay, CYP3A4. This is correct. Now the CYP2D6 SSRI, correct. CVS CNS, in CNS SSRI. CYP2C89 mifepristone, no, mifepristone was metabolized by Dia, Mirza, MI, CYP3A4. 2C89, what were the substrates? Warfarin, phenytoin, glipizide, losartan. CYP2C19 propranolol, correct. So the answer is C, mifepristone. Next question, which is wrongly matched regarding drug elimination? Option where again wrongly matched is asked. Calcium channel blockers, CYP3A4, calcium, carrots, calcium, metabolized by CYP3A4, correct. Carvedilol, CVS, most beta blockers, metabolized by CYP2D6, this is also correct. Now digoxin is P by P glycoprotein, you know it's correct. Simvastatin glucuronide conjugation, we saw statins are metabolized by CYP3A4, but statins are also metabolized by glucuronide conjugation. Now both of these options are partly correct, so you have to select one option from these two. See, what is the question asking? Drug elimination. Digoxin causing using P glycoprotein, it is not used for drugs metabolism. It is either this P glycoprotein plays a role in drugs digoxin's absorption as well as excretion. It has no role in metabolism. And simvastatin, there is role of glucuronide conjugation, but still the answer is not clear, because in elimination we have both metabolism as well as excretion, and this plays a role in excretion. So we will see what will happen if we induce this. If you induce this P glycoprotein, what will happen to digoxin? More digoxin will be excreted, digoxin blood levels reduce. So digoxin levels reduce by induction of this P glycoprotein. And similarly, if we induce this glucuronide conjugation for simvastatin, metabolism is not increased. Simvastatin levels remain same. So glucuronide conjugation, though statins undergo glucuronide conjugation, it is not it does not play a major role. Hence the answer what I will select is this D. Next question. Again, which of the following combination can result in severe toxicity due to P450 inhibition? This was asked in 2019 JIPMER. If you see options, cimetidine is enzyme inhibitor, so this can be correct option. Clarithromycin is also enzyme inhibitor, and itraconazole is also enzyme inhibitor. So all these can cause enzyme inhibition, and all these can increase the blood levels of these drugs. Okay, and rifampicin is enzyme inducer, so we will rule out this option as not correct. Okay, so in these three we have to select one. If you remember what I said in enzyme inhibition, see, one more important thing what the examiner wants to know is severe toxicity. All these three can produce severe toxicity. Again, you are not getting a clear cut answer out. So here lies the concept. What concept we discussed? If enzyme is inhibited, which group of drugs will cause toxicity? Only those drugs which are undergoing zero order kinetics will be only zero order kinetic drugs will be precipitated, toxicity will be precipitated. And among the following options, warfarin is following the zero order kinetics, hence this will be the answer. Consider if warfarin was not given in the option, then what will you select among amiodarone and atorvastatin? I would have selected amiodarone. Why? Because both are having severe toxicity, correct? But atorvastatin is having a broader dose range group. It can be given from 10 to 40 or even 80 mg per day, and only severe toxicity is myopathy, and its incidence is very less, whereas in amiodarone chances of severe toxicity are more. Hence I would have selected amiodarone. So the answer will be warfarin plus clarithromycin. If that was not option, the next best answer will be amiodarone followed by last atorvastatin. Next, induction of microsomal enzyme can result in. If microsomal enzyme is induced, consider the example of carbamazepine. It was inducing its own metabolism. So with further dosing, what you will have? You need more and more dose of carbamazepine. So it will produce tolerance is correct option. Dependence, no. Super sensitivity to a drug, no. See this one option, toxicity of the drug. What I said, paracetamol, CYP2E1 getting metabolized and producing NAPQI. So if you induce CYP2E1, NAPQI will be produced more. So again, this toxicity is also a correct option. So among the two, what you will select? What I said, there is most drugs will get inactivated, and there are very few drugs which are having toxic metabolites. So we will keep this option out and we will select tolerance as a best option. Next, OCP failure occurs when used with all of the following except aspirin, tetracycline, phenytoin, rifampicin. If you see phenytoin, rifampicin, these are the enzyme inducer. They induce OCP metabolism, OCP failure will result. Now the remaining two options, aspirin and tetracycline. What I said, tetracycline or antibiotics, they cause and they inhibit enterohepatic cycling. How they inhibit enterohepatic cycling? By killing the intestinal bacteria. So thereby causing decreased rotation, decreased enterohepatic cycling of OCP. OCP becomes shorter acting and will result in OCP failure. Hence the answer will be here aspirin. Similar question C, which does not affect metabolism of oral contraceptive pill. If you see here, again phenytoin is enzyme inducer, griseofulvin, GRI is also enzyme inhibitor, primidone giving rise to phenobarbital. Phenobarbital is again PCP enzyme inducer. So these all three are enzyme inducer. Penicillin also inhibit enterohepatic cycling. So all can cause OCP failure, but you have to select one best option. So enzyme inducers definitely are going to metabolize OCP and OCP failure. This you can select here as answer. So depending on available option, your answer will change accordingly. So answer will be penicillin. So we have finished with absorption, distribution, metabolism. Next class we will be discussing with excretion. Thank you.